And I want to remind people where we were a few decades ago, frankly, where we were just 6 or 7 years ago. No strategies, no plans, no approach. The state of California was absent. State did not have a strategy for behavioral health, did not have a strategy for integrating issues of substance abuse and mental health, did not have a strategy to integrate housing, did not have a strategy to support cities and counties as it relates to developing strategies to get people off the streets and sidewalks, did not focus and prioritize encampments. No strategies, no plans, and little money. It was the creation of a new program that we are highlighting today, the HAP program, but it came with no strings attached, no accountability, no transparency. That's changed dramatically. And it's changed because we needed to change. In 1959, there were 37,000 locked beds in the state of California, and a population that's half the size of the population today. 37,000 beds in a population that's half the size today. When we initiated an effort to try to knit back investments, we highlighted that roughly 5,500 units exist today. Population that's double the size. 37,000 down to 5,500. It's the origin story here in the state of California. Yes, it began in the early 60s, accelerated in the late 60s, promoted with no support, but this notion promoting local community-based care, but no real support from the state. And of course, it was accelerated federally, infamously, during the 1980s. One component part of that that's interesting, it was a bipartisan endeavor in its origin story. And so while it's easy to cast aspersion and point fingers, it was both Democrats and the Republicans that wanted to move in a different direction. But ultimately, we fell short. No state has been more impacted than the state of California. For one reason, the original sin is not just the lack of investment in behavioral health, it's a lack of investment in housing, period, in the state. We all skipped 7th grade Econ 101. Supply demand, it's not complicated. And for decades and decades and decades, we had housing policies, frankly, outsourced to local government, just as has been the case with many of the behavioral health and homeless programs until the last few years. And that's why I want to brag on the Senator, the 2 Assembly members, and our partners, not sparring partners, working partners at the city and county level that recognize we need to do things better and do things differently. We created a new website, accountability.ca.gov. Accountability.ca.gov. I encourage you to take a look at it, to take a look at how your local officials are doing. State vision is realized locally. State vision is realized locally. I've said it many times. Localism is determinative. Housing, homeless, the work that's done locally, the work that you did together here. It's not the state. The state enabled and supported it. You made it happen is what we're focused on here today and what we've been focused on over the course of the last number of years. And that's why numerically we're calling people out. We're also highlighting success. Alameda County is one of our success stories. And we've highlighted them on the accountability.ca.gov website as one of the outstanding leaders in this space, yes, Care Court, but in many different spaces as it relates to the partnership and the utilization of state-backed programs and funds. Humboldt County is another. There are a number of counties that get it and are getting things done, proving it can be done when you have leadership that cares enough to get it done as opposed to dials it in. They've dialed it up.